Governor Parnell, mentioning the health care lawsuit, Democrats have accused you of foot dragging and implementing some of the more popular provisions for state employees. Senator Hollis French says you're delaying as long as legally possible provisions like getting kids staying on their parents' health insurance plans until age 26. And he and other Democrats are upset that you're not offering the Health Care Act benefits to state retirees. States aren't required to do that, but some are. It's an option. Do they have some validity in saying you're holding back?
Well, it's true that Senator French and Ethan Berkowitz are on one side of that universal coverage and want government health care. I don't. So when I'm accused of foot dragging, what I'm doing is taking each deadline in the federal legislation on a case-by-case basis. For example, when the federal government says, here's some money to go set up a health insurance exchange, but you don't have to do it till 2014, but you ought to maybe start doing it now, and here's the money if you want to buy in a little bit. I said no, because let's finish this lawsuit and see if the individual mandate gets overturned. That will directly bear on the health insurance exchanges, and we've got 4 years more before we have to buy into a system that right now I don't buy.
Mr. Berkowitz, you surprised some Democrats by saying you'd actually stick with the lawsuit over the health care law.
That doesn't mean we don't have a responsibility to find health care solutions for Alaskans. And I've also been very clear that we need to do things here in state. We need to take better care of ourselves. We have to pursue some of the options that are available through the health care bill. The health care bill makes it possible for Alaskans to buy insurance over state lines. It allows small businesses to pool together. It allows for supplemental payment of Medicaid or Medicare. So if a patient goes to a doctor and the doctor says, I can't lose money on you, and the patient says, fine, I'll give you the extra money either through cash or through additional insurance. We've got to do more for growing doctors and nurses in the state. We need more with telemedicine. We've got to do things because fighting the federal government doesn't help someone who's hurt or sick.
In 15 seconds, would you try to bump up the timeline for getting state employees some of the benefits?
Absolutely, I would bump up the timelines because every day we delay is a delay that people who might be beneficiaries of that kind of health care aren't receiving it. And we can have these good academic distinctions between what we want to do and what policy should be, but real people are suffering in the crossfire.
Well, but
sorry, we need to move on to Dermot.
Well, I think I'd like to give the governor just a short
well,
rebuttal to that.
That's ridiculous to make that kind of an assertion. I just spoke with a small business owner who said that they just got their health insurance premiums notice and it was raised 46%. When they went back to their insurer, they said, the insurance company said it's because of the new mandates imposed by federal health care legislation. I am not going to let us get sucked into a system without having a court fight when it's going to raise insurance premiums by 46%.
Okay, at the risk of going on too long, Representative Berkowitz.
When Sean cut the additions to the Denali Kid Care, those were real kids, 1,200, 1,300 kids with names and faces and families who aren't getting the health care that they deserve. It's all those expectant mothers who aren't getting the health care that they deserve. And I understand his philosophical objection to it, but real people need real treatment.